Bismillahirrahmanirrahim. Assalamu alaikum. Have you ever experienced that after taking some food, you have developed hives, itching, swelling of the face, lips, or stomach cramps, or diarrhea or vomiting, or even shortness of breath? If so, you may be suffering from food allergy. And if such event happens regularly with some specific food, then definitely you are having food allergy. In today's vlog, we shall discuss what is food allergy, why does it develop, what are the symptoms of food allergy, how we doctors diagnose that someone is suffering from the food allergy, what is the treatment required, and how we can prevent food allergy. So be with me in today's discussion. We will try to get the answers of all these questions. As I said, topic for our today's discussion is food allergy. So what is a food allergy? A food allergy is an adverse reaction to a specific food protein, which can cause a range of symptoms, from mild discomfort to life-threatening anaphylaxis. So basically, is the body's allergic reaction to a specific food protein. What are the common food allergens? These include peanuts, tree nuts, milk, eggs, fish, shellfish, wheat, and soy. So these are the top most common 8 food allergens which leads to food allergy. I repeat, peanuts, tree nuts, milk, eggs, fish, shellfish, wheat, and soy. If someone is allergic to these food elements and he or she consumes these, what symptoms he or she can have? So what are the symptoms of food allergy? That person can develop hives, itching, swelling of the face, lips, tongue, and throat, stomach cramps, diarrhea, vomiting, shortness of breath or wheezing, and even anaphylaxis, which is a severe life-threatening reaction. So as I said, the symptoms may range from mild to life-threatening situation. How this food allergy is diagnosed medically? Of course, it is the medical history has the pivotal role. We take the history, how that reactions develop, what type of food, if it is the person had eaten. So the medical history is very, very important. The person may be having some other disease, and this may be a manifestation. Then physical examination And of course, when someone is brought in a serious condition, we take the vitals and ensure that there is no danger to his or her life. Then in the investigations, one is the skin prick test. This is done to determine protein is, which type of protein is responsible for the food allergy. And then we do some blood tests, including the IgE levels. And of course, another test is oral food challenge. All these are done under the supervision of the doctor. It cannot be done by a layperson, him or herself. Once the food allergy is diagnosed, how to treat such people? Of course, number one step is to avoid allergenic food. Whichever food item causes food allergy, avoid that. Second way of treatment is epinephrine auto-injector. That whenever there is a reaction, there is the epinephrine injection and a small dose, and the person injects him or herself and thus compares the food allergy. But that is prescribed by a doctor to you. Then taking antihistamines, tablets or injections, corticosteroids, tablets or injections, and even the immunotherapy, which is the desensitization. This is another way of treatment of food allergy. Can we prevent the food allergy? Yes. The very important way is encouraging breastfeeding. The food allergy starts from the early childhood. So those babies who are breastfed, they have got least chances of developing food allergy as compared to those who had the formula milk or who hadn't the breastfeeding. So encourage breastfeeding. And the role of breastfeeding in avoiding food allergy, I'll make another vlog, and there we will concentrate only on the breastfeeding and its role in reducing the risk of food allergy. Then the second way is to prevent the food allergies, introducing allergenic foods early. And of course, this is done by the doctor, not by yourself. Avoiding strict dietary restrictions, this is another way, and maintaining a balanced diet, and of course, consulting a healthcare professional. How you can manage the food allergy? Some tips for that is that you read the food labels before purchasing it from especially the packed food. And if you are a patient of food allergy, then of course you must be having an emergency kit with you, because it can happen anytime, either in some function or in some outdoor dining, in hotel, in restaurant. So you should have an emergency kit with you. And you should inform others that I have got food allergy if it happens, what to do. And of course, you develop an emergency action plan, that if such happens, whom to contact, how to go about. And of course, you regularly review and update that plan for you. But you do this with the help of your medical practitioner. So, dear viewers, today we discussed the food allergy. What does it mean? What are the causes? What are the top 8 food allergens? What are its symptoms and how we diagnose that someone has got food allergy, how we treat that, and how we can prevent the food allergy. Other vlogs of mine on the food allergy, you can see those in the playlist of the food allergy and food related vlogs in English as well as in Urdu. And remember that I shall discuss the role of breastfeeding in reducing food allergy in a separate vlog. Please do watch that as well. So it's goodbye from me. Take care. Khuda Hafiz.